Good evening, everybody. Dr. Mr. Suresh Kumar is a passionate professor and researcher who is striving in behavioral sciences and education, has done PhD and MSc Applied Psychology from Annamalai University, and also MSc Counseling and Psychotherapy from TNOU. And presently, he is heading the PG Department of Psychology, the American College, Mathurai. The areas of his expertise are psychometry, statistical analysis and research, documentation, counseling and psychotherapy, and many more. And just a minute, sorry. And he has published around 30 plus papers and 3 books and 50 seminars. He has organized 50 seminar. Sorry, I'm so sorry. Has organized 750 plus programs and acted as a resource person for 300 plus sessions. And he has secured many awards and recognitions since 2019 till date. We will welcome you, sir. I'm so sorry.
Sudha, mute others.
Yes. Am I audible?
Yes, sir.
Okay. Thank you. Very good evening, Tech on Positive Mental Health Group members. I'm really happy to be here to share a very prominent topic. I would like to tell you why I selected this topic. I have completed my PG in the year 2005, and I started practicing counseling in the year 2013 only I started. See the gap between the course I have completed and the practice when I started. The reason for not beginning counseling, it is because I had a doubt whether I am capable to provide a counseling, one thing. And second thing is about whether I am master in all the techniques and therapy. Initially, I'm not having the distinction between the two terms. I think in the topic we can find out how to select an appropriate therapeutic technique. I thought therapy as a technique. So these things I had many years, I can say. When you ask precisely when I got on complete clarity, when I'm preparing for classes of psychotherapy and counseling techniques, I got an insight. I very frankly say that I got an insight. Previously, before that, can take up to 2013, I had an idea that we are having in broad, we are having at least 6 techniques or 6 therapies only. For example, in behavior therapy, we are using only behavior component. Then when I'm doing a research to finding out number of techniques in therapy, especially in behavior therapy, it is a request from one of my friends. Can you please let me know the technique which is there in behavior therapy? So is there techniques are there in therapy? So this was a question I asked to myself, and I found a different research article. And what I was found that, can you guess anybody how many techniques may be there in behavior therapy? I'm not given any clarity about what is therapy, what is technique. I'm given just intro. How many techniques may be there? We can take therapies on bigger one. And
Cognitive behavioral therapy.
Yeah, cognitive behavior therapy is on different component. I'll come to for that. I do share some of the content in the group. Okay, I'll let you know. How many? 16. No. That's different. That's actually it is for our personal understanding. But what I done, for preparing that different techniques and different learning theories, it comes around 120. 120. Can you believe that these many techniques are there in behavior therapy alone? Think about that other therapies, the broader categories, psychoanalysis, gestalt therapy. We can come to that other components like humanistic therapy, existential therapy. And these are the broader therapies. Under broader therapies, we are having that blended method also. So how we can get on clarity about these things, I will let you know. First, we will find out what are the broader approaches are there. Mental health doesn't mean that it is regarding cognitive problem alone. It has some three important components. If any person who come for mental health related problem, one is about behavior, second one is the emotion, third one is cognition. And there is one more fourth one which is not known to many people. I can say that it is called the interaction with the society. So very commonly we can find out if any person who come for mental health related problem, we can focus on behavior, emotion, and cognition. Okay, keep in this mind. When we look at that history of treating that mental illness, it comes from the psychiatry, not from psychology. We have to accept that. It comes from psychiatry, and we can say the very popular person is Sigmund Freud. And he is the one in psychoanalysis who come up with two techniques. And some people, they will say that 3 or 4 techniques, but I believe that only 2 techniques very popular. So one is about catharsis and another one is dream analysis. These are the 2 techniques introduced by him. And under psychoanalysis, and these 2 techniques meant for immediate relief of emotional abuse, emotional traumatic experiences, if anybody had in their lifetime. And it will help them to relieve from the pain. So this is the first thing he has done. And over a period of time, I can say that there are a lot of reformation that happened. And I can say that the one person in the psychoanalysis who had a conflict idea with the input given by Sigmund Freud. Can you tell me that who is the person who started his own school of thought?
Eric Berne, transaction analysis, probably.
Maybe, sir.
Adler.
But close.
Adler. Alfred Adler.
Adler, amazing answer. Adler is the one actually. When we look at that in psychoanalysis, most of the techniques, nearly 21 techniques, not a single, 21 techniques suggested by Adler only. And all the techniques based on psychoanalysis basis. And after him, Carl Jung, again, and these are the persons. When we look at that in psychoanalysis itself, when we accumulate all the inputs from that psychoanalysis perspective, we may get nearly 30 plus. I'm not sure. Based on my understanding, 30 plus techniques are there. 30 plus techniques. This is a broader approach. Then we can come to that after psychoanalysis, we can come to the behavior. And I can say behavior ruled in therapy for more than 7 decades, not a single day. 7 decades. There is no competitor for them for behavior therapy. Because most of the behavior therapeutic techniques are taken from learning theories. But if there are many of us, even I had a confusion regarding the founder of behaviorism, J.P. Watson, John Bradshaw Watson. Who is the founder of behavior therapy? He's not. Can anyone guess and tell me? J.P. Watson is the father of behaviorism, sir. Yes, I agree. Who is the father of behavior therapy? Therapy is an application part of behaviorism. Am I right?
Was it William James?
Learning theory from the social learning theory.
No. I'm asking the name of the person who we can call. No, Skinner is highly contributed in that.
Albert Bandura.
Albert Bandura, social learning. Lovely guess. But no learning theory persons will come under that answer. No learning theory proponent will we claim him as a father of behavior therapy.
Pavlov.
Pavlov, I think. Thorndike, these are the people are there.
Okay.
Kohler, Westermeer. Yes, these are the learning theories. Even Kurt Lewin.
Aaron Beck, sir.
Yes.
Aaron Beck.
Aaron Beck is on cognitive therapy.
Cognitive.
Okay.
So my question is about who? Rotor, yes, no. Aspiration and aspiration. Level of theory.
Okay.
Okay, I'll give the answer for you all. The answer is Joseph Wolf. And when you Google it, the name will come. And Joseph Wolf is the father of behavior therapy. And we can understand why J.P. Watson or Skinner are not the father of behavior therapy. Actually, their intention is not for therapy. when they are developing that theory, for example, operant conditioning, observational learning, their intention is to maximize that behavior or to strengthen the behavior. That is the ultimate aim of those people. But later, 1956, and these theories were happened 50 years back. 1902 is he got a Nobel Prize, Ivan Pavlov. He got a Nobel Prize for his theory in the 1902 for medicine. But actually, his contribution widely used in learning and psychology. But he got a Nobel in 1902. But 1956 only the behavior therapies are popular. Joseph Poole came and he took that. There's a gap is there, theory, and none of the theories were applied in practice. That's why, as I said, when you take, for example, in Pavlov's conditioning theory. So what is the classical conditioning? What is the key applications or principles of case theory? Generalization, distinction, memory. Have you aware about these terms? Inhibition, extinction, spontaneous recovery. And these are the principles of his learning theory. But now we can use these components in therapy. Earlier, he was not given anything, but later only it is given. Okay. The first therapeutic, I can say psychoanalysis. Second one is behaviorism. Then he gets the third one. Third broader approach, which is very popular.
Cognitive.
Lovely. Cognitive therapy. So in cognitive components where I can say that there are three schools of learnings are there, learning theories. Cognitive learning theories emerged only because when you look at the learning theories of stimulus, there is a response. That is the ultimate principle of learning theories by behaviorists. There is one people who came there. There is a stimulus, there is a response. What is there in between? That is the curiosity of the people, cognitive psychologists, and they came. Cognitive psychology said, in between stimulus and response, there is a process. We perceiving, we are processing, and we are giving attention, and that need to be studied. That has a very impact on our application. So cognitive therapies came, and the cognitive therapy's ultimate aim is to understand that if there is any problem in that cognitive component, like problem solving, decision making, language, and it is related to memory. So those components were highlighted in behavior therapy, cognitive therapy. And yes, cognitive distortions were later incorporated. I'll let you know how Aaron Beck and Albert Ellis were open on cognitive therapy in big picture. And now if you ask me, if you take 100 clinical psychologists or 100 therapists, I can sadly say that 80% and more than 80% they will depend or rely on cognitive CBT only. 80%. Very limited people are using other techniques. If you ask me that, and the other component is a humanistic approach. After cognition, there is a humanistic approach. Can anyone tell me how humanistic approach, how humanistic therapy is totally different from these three? Psychoanalysis is about unconscious, conscious, subconscious mind. Behaviorism is about anything we can change by practice. Okay. The systematically when we do, we can. Cognitive therapy, when we make a change, when we make the person to believe and we can able to make a change. And the last one, humanistic therapy. Humanistic therapy, it focuses on that, whoever it may be, X, Y, or Z. You can take it X, Y, or Z, irrespective of race, caste, color, and everything. Everyone has a potential to solve their own problem. If you take me, if I'm not feeling well, I'm having the potential to solve my problem. If I'm not studied, if I'm studied, whatever it may be, whatever your level, every person has or have the potential to come up with and make their own decision. That is the main thing. The only thing they are not aware about it, they are not realizing the self. Self-realization is an ultimate thing of humanistic therapy. So these are the broader approach. Then we'll come to that. After broader approach, there are pure therapies were common. Pure therapies. Can you name the pure therapies? Some of the pure therapies. Yeah, personal words, concurrence. Some of the, if you ask me that what is the three key contributions of humanistic therapies on unconditional positive regard, empathy, concurrence. These were the self-realization or self-actualization are the important contributions of humanistic therapy. Can you please share that the picture which I was shared earlier in the group? Only that image alone, the first image alone. So up to that, anyone can let me know. In counseling or therapy, we are having only 3 methods are there based on the process which is involved. So what are they? I joined my mobile and I have to.
Yeah, sure.
Can anyone tell me give me the answer for my question? And recently I bought a book, Counseling Therapy and Techniques, Rosemary and Thompson. See, I had an idea. I got an idea. So overall broader approach is on more 4 to 5, and the pure therapies it will come 8. The maximum 8 into 10 we may have 80 techniques. But in that single book alone, and she has mentioned how many techniques? More than 500 techniques. Yes, when you look at this picture, after the broader approach, we can see here the pure therapies which is evolved from the broader approaches. For example, in psychoanalytic approach, we are having the 2 broader category. One is a psychoanalytic, another one is Adlerian, very popular. Adlerian itself as a 2 years program. In USA, when you Google it, they are offering Adlerian therapy, master degree program on Adlerian therapy alone for 2 years. So think about how extensively we have to study about it and what are the components will be there inside. So such a huge component. And in behavioral approach, we are having behavior therapy and applied behavior analysis. Applied behavior analysis commonly used in special education. Anybody here from special education, and they may know about it, the importance of using applied behavior analysis. And in humanistic, there are 2 components. One is on person-centered therapy, another one is existential therapy. I can say it's like a purely on logical, purely on philosophical component, this approach. And finally, when we look at that cognitive, we may think about only brain, but later they included the emotions also, the reason. So this component they included. Okay. So these are the pure therapies. Under pure therapies, sometimes they integrate humanistic with psychoanalysis. You look at here, the integration of humanistic approach and psychoanalysis, it forms on 2 components. One is on transaction analysis and another one is gestalt therapy. Another one is gestalt therapy. And when come to here, the behavior and cognition, it merge into one is about cognitive behavior therapy, another one is REBT. The integration of 2 broader approach, 4 broader therapies, we can get 2 integrated components. And finally, eclectic method. Eclectic are, some people will say that I'm an NLP practitioner, I'm an NLP trainer. The NLP is on combination of, they will select here and here something and here something and here something. It is on composition of all the components. That's why it is very popular. Very popular. I'll share the book. The book name is Rosemary and Thompson, Counseling and Therapeutic Techniques. It has more than 500 techniques. You can get it in Amazon also. I'll do share the content with you. Now, I hope you all having some idea about how these therapies are we are using in our practice. One is about the pure therapies, integrated stuff we can say blended, and another one is eclectic. Eclectic is on like Kutanjoru in Tamil. They will collect here something and here something and they will select and very beautiful flower. So that is the way they will make it. An eclectic method are very popular. One is a multi-model and another one is NLP. Are you clear about these things? Okay. Now I'm come to my topic. How to select an appropriate technique. So we know that the therapy alone approach, pure therapy is integrated and eclectic. So these are transformations that happen in therapy. Under the therapy, we are having more techniques. More and more techniques are there. As I said, when I was doing a research, I found that more than 120 techniques are there in behavior approach alone. Behavior, when you consolidate all the learning theories, stimulus response, cognitive and observational, and just learning theories. When you consider all the theories, it will come nearly 28, and each theory has many principles, and each principles we can convert into some techniques. Techniques are more specific for more specific purpose. Excuse me. 1 minute, 1 minute. Yes, I'll continue. For example, I will take anxiety. Okay, now, anxiety comes under which component? Emotional, behavioral, or cognitive? Anyone? How to select an appropriate therapeutic technique? Anxiety is the problem in a person. So, you have to tell me anxiety is a cognitive problem, emotional problem, or behavior problem?
I think it's cognitive.
Lovely. It is a combination of all these three. Am I right? Now, we have to find that purely on cognitive it will not work. Purely on behavioral component it will not work. Purely on other component it will not work. That's why we have to go for integrated therapies. Now you got an idea? You have to check the problem of the person. It may be anything. Okay, I'll give another thing. Thumb sucking. Just imagine you can find out young kids. They used to have a behavior of thumb sucking. So what is the problem of this thumb sucking?
It's a feeling of insecurity, sir. Is it a feeling of insecurity and child is
fall under
insecure?
which category, ma'am? The three broader categories: behavior, emotion, or cognition. Thumb sucking.
Is it behavior, sir?
Lovely,
Emotional,
lovely.
emotional
No,
technique.
behavior. Thumb sucking is the behavior. See, we can able to, if you want to make a change in these thumb sucking, it's a behavior problem. We can use that behavioral therapy. And in behavior therapy, there is a specific technique is there. What is the technique we can say for these thumb sucking? More specifically, there are no single technique is there to solve. There are many techniques are there in behavior therapy itself. One is called systematic desensitization. Am I right? What they will do? They will use neem oil in his finger. First time he will have a bitter taste, and then he will take it, and then it will be systematic desensitization. And another one is aversion. There are punishments will be given to them. When look at that, if someone is watching, they will not do the punishments. So these are the different techniques. Even token economy also can be helpful for them. It is also behavior technique. When we find out the problem is particularly for behavior, particularly for emotion, particularly for cognition, we have to select appropriate technique from that category. Here is the when you want to claim that you are a most effective counselor, you check these things. And I will give one more example. I'm worrying a lot. Which comes under which component? Worry.
Cognitive.
Is it the cognitive, sir?
Cognitive plus emotion.
Emotion. Okay.
Cognitive is the dominant one. Emotion also there. Lovely, sir. See, when these category, CBT will not work. Understand? Cognitive behavior not work. REBT will work for this person. Rational MOT behavior therapy is an ideal for that. Under REBT, there are many techniques are there. You can select an ideal one. Is it clear? And there is I will give on one more trick for finding the right technique for the problem. As we all know that we are having different developmental stages. Children, adolescents, adult and elderly. So these are very common developmental stages. A children has most commonly, what is the dominant problem a children may have? Which part of the area? Behavior, emotion or cognition?
Behavior. Sir.
Behavior. So when children come, your intention, if you want to be a more efficient counselor, efficient therapist, you have to go for behavior therapy. But if it is on children, because most of the children's problem are related to behavior only. And we will come to the adolescents next stage. What is the common problem for the adolescents?
Emotional, sir.
Amazing now. Emotion. So we have to select emotion related. REBT, rational MOT. That will be highly work for them. And we will move on to that adult.
Cognition.
Okay. So now you know that now as I given that based on the problem itself, we can select ideal appropriate technique. But now we know that by looking at the age group of the person, behavior, emotion, and cognition, and we know that children, adolescents, and adults. Adult means go to that cognitive therapy. That will work for them better. And one more thing, even some people look like an adult, but they behave like a child. Some people behave like a child. They look like a child. They may be less than 12 years, but they behave like a mature person. Here, we can use what is the persona they are having in transaction analysis. They'll say, child personality, adult personality, and parenting personality. If we have to find out which one is more dominant, and based on these dominance, we have to select appropriate technique. Is it clear? Lovely, sir. Okay. So now, when a client come to me, see, if I am having only one option in front of me, I will take only that one. Am I right? If I have in front of me more than 200 techniques, then I will have a confusion. Which one I have to select? Then what I have done? Very simple. We know that these four developmental stages: children, adolescents, adult, and elderly. When you go to the World Health Organization or leading mental health organizations like APA, they given that developing countries and developed countries 10 behavioral problems, top 10 behavioral problems of children. They given already. Whoever come to your counseling center, whoever come to your therapy, they fall under at least any one of these components only. Behavior problem 10, they given the top 10 behavioral problem among the children means pyromania, kleptomania, ODD, opposite deviant behavior, ADHD. So these are the common. They listed out. And when you know about for each problem and what are the techniques we can use, like you have to prepare a chart. And it is very easy for us. Very easy for us. Likewise for adolescents. Adolescents, what are the common problems? Top 10 problems. And for adult, what are the top 10 problems? For elderly, what are the top 10 problems? Okay, when we match that, as we know that for children is on behavior therapy. Behavior therapeutic techniques you have to select. For adolescents, emotion related therapeutic techniques you have to select. For the elderly, you have to understand. Elderly, even CBT not work for them. Can someone please let me know what is the best therapeutic technique will work for elderly population?
Person or humanistic therapy?
Humanistic. Lovely, existential or logotherapy will work for them more efficiently, and followed by gestalt therapy. Gestalt, or you can go for existential therapy. If it is an elderly population, you can select your technique from these components. So this is the way I select for my counseling center, and I found that generally what we will do trial and error. Trial and error will help for some extent. For many people, it will work for some. when you want to prove that you are more efficient, and you have to use more logically. When we are playing carom board, we know that when we use a striker, where we have to hit. The same thing we have to use in our selecting the technique also. Because the client in India are not such a thing, they will come for more than 3 or 4 sessions as per my experiences. They will not come more than 4. If they come and you are blessed and they are depending on you. But in Western countries, it is not a condition. If they are having the contract with the therapist, they must come at least 12 sessions minimum. Minimum 12 they have to come. Have anybody here who are practicing counseling, if you had more than 4 sessions with the same client? Anybody is here? I can say, based on my personal experiences, it's very difficult to have more than 4 sessions. And when we use one technique, we have to be very clear. And when we are not thorough about, when we are not having clarity about the technique we are suggesting will work for him, and you have to admit that here, I suggest this technique based on my research experience, based on my understanding. And it may work for you, not work for you. And we can give that these are the different strategies, different techniques are there in front of us. Sometimes it may work for you. If it is not working, don't worry about it. We'll go for second one. So this is the way when you say them, and then we'll have the faith on the client and they will come forward. So I used to admit them. The first condition I used to say them, okay, you are coming here for solve your problem immediately. I will say I'm not such a person. If you have an idea that I can solve your problem in single sitting, please get away. Second thing, I studied, I'm having some experiences and exposure. Based on that, I will suggest. And you have to make a decision. So I never keep the ball with me. I will put the ball to the client itself. At one point of time, they will say that, okay, so you are not having confidence. I can say that wherever you go, this is the thing will happen. I'll give the psychoeducation to the client who are coming. Not only me, man. If you go to anybody, the same thing will happen. If you want sweet-coated statement for your problem, yes, I can solve your problem in 2 sittings. No. And you will be exposed. I can say that the first 2 sessions you will have the claim. Third session, I can say the tipping point. No one will come to our counseling center. Not only coming, they will spread the news that, okay, this person will cheat us. So that kind of thing will happen. And I can say, we have to be very clear and we have to admit that what we can do and what we cannot be able to do. That clarity, that understanding we have, and we can do better. Now, I hope you are having the clarity about how to select on pure approach, integrated, pure therapies, integrated, and finally eclectic. This is the way you can select. And based on the developmental stages, I given that what is the common problem will be there. And finally list out the top 10 problems, behavioral problem, emotional problem, and cognitive problem of different age group. And you can list out the techniques appropriate for that. And it is very easy for you. You can select lovely techniques. Even the first time itself, we can make an impression. So I had such a experiences in my life. I cannot say that. I still remember once my student who asked me, "Can you come and take a session?" Even after 11 years of experience, I said no. Because I must feel confident about I can able to deal with the problem. I told him, because you taken the client for more than 3 weeks, you continue. I can give one suggestion. If I come there and I may be knowingly or unknowingly, I may say that what you have done is wrong. I don't want to make you feel down. One thing. And second one is, when I'm taking up a client from you and I must feel more confident, then only I can take. As I said, okay, I'm having very clear in my mindset. I think when Sunanda and other members ask me, so what is your core area of selecting the client? My core area of selecting this therapy for wellness, not for treating the illness people to the normal. You have to understand wellness and illness. -10 is an illness, severe mental health problem. You are not supposed to do anything with them. Psychiatrist. -6, -5, -4, mild, moderate. Moderate therapists are there. Yes, I can able to do that, but I won't go there. So I'll let you know. Even I'm not interested with them. And where I'm interested, I can say that the -3, -2, -1, 0, 1, 2, 3, 4, 5. And these people, when they want to go to the +10, yes, I can use these techniques for positive mental health. That's why when Sunanda said that Deccan positive mental health, I'm happy to be there. I'm proud to claim that I'm a positive mental health practitioner. When we make the person in the wellness component +10, and if they fall down, they will come to the +5 only or 0, not minus. They will be normal. So we have to make every person who come to our counseling center, not to make a neutral, go to the positive component, at least +8. So that is an ultimate aim. And there are a lot of techniques are there for positive mental health practices. I can say one final concluding remark for my presentation today. I can take one volunteer. Atvika, can you unmute yourself?
Yes.
Yeah. Can you please tell me how you feel today? I will give 3 options. Not good, average, good.
I feel good.
Good, very good. So do you know the reason for that, for feeling good?
I think so. I had a good day, so I feel good.
Lovely. Okay, you had a good day. I will let you know what is the exact cause or reason for the good day.
Okay.
See, when Ms. Atvika is saying that I feel good, it doesn't mean that she not had on downs in today. We had an ups and downs. But most of the time we experience the positive component, flourishing component. That's why we can say good. And there is a researcher called Barbara Fredrickson. When we discuss about all the therapeutic techniques intention is to make the person illness to normal, neutralize. But positive therapist intention is neutral to positive component. So Barbara Fredrickson, what she said, her theory is about broaden build theory. Broaden and build theory. What is broaden? When we had on the first emotion, first experiences as on positive, and we can make the whole day as on positive. When we had one negative experience in the beginning, the whole day will be negative. And also she also said that we can able to alter. Suppose if you had a negative experiences in the beginning, we can able to alter. We can able to alter into positive. And when you make an alter, we can able to make a change in our daily experiences. I can say the best thing is about practice positive emotions. All the positive emotions are wellness techniques. All the positive emotions you can use as an wellness techniques. You can take it from pride, love, gratitude, serene, awfulness, amusement, joy, inspiration. So these were the components of wellness techniques. I can say the one from emotion perspective. There are other people are working. You can take Martin Seligman's Burma V model is there, and Michele, he given some the flow concept, immersing ourselves in our. These are the positive techniques. Positive techniques, I can say, if you ask me at present, 0.001% people may practice, including people who are here. So many of us, we are not practicing positive therapeutic techniques. So like me, if you are interested to focus on positive therapies, you can let me know, and we will form like a take on positive mental health. We'll form as a group, and we will come up with our own techniques in future. With that, few experiential sharing, I can stop here. And if you have any questions to my presentation, you are welcome.
What I feel is, Dr. Suresh,
Yes, sir.
what you said is correct. We have to start with a positive feeling. That is why I feel when you get up immediately, you affirm yourself. I am happy,
Yes.
healthy, wealthy, active, and progressing in my life. Most of the people say, "What day is this? Nonsense. Yesterday this." That is why in Hindus they take with a god. Sometimes they take these both the palms. I hope you know that mantra.
Yeah, yes.
Karagre Vasate Lakshmi Karamajis Saraswati Karamure Gauri Karpurushte Govinda. Why we say like that? To keep ourselves positive. Then affirm yourself. You put your hand here in your brain and say, your finger in the head and say, I am positive, healthy, active. Every time
Yes.
you have to repeat. Then, when you increase the positive energy in you, automatically, as you said, negative energy will come down. That is how I look at it.
Yes.
Thank you.
Yes. Thank you, sir. Thank you. Thank you. Thank you.
Thank you so much for this wonderful, awesome learning session. It was really, I feel that the positive mental health start with the mindfulness techniques.
Yes.
So
Yes.
I'm very happy. So here I want to tell that mindfulness. I learned lots of therapies, even though we learned, but the prioritize from the psychoanalysis, behavior therapy. There is a broader terms are there, like you said, in RABT also, and CBT and Gestalt. There's lots of new information. Joseph Wolfe, father of behavioral therapy. So lots of learning, sir. And as you said, we will form a positive mental health group. We will learn day by day in every way. I'm getting better, better, better. Thank you so much.
Thank you. Thank you, Ambia, for consolidating and summarizing my presentation.
Thank you so much. Yeah, wonderful session, Suresh sir. Like loads of learning, and the wonderful learning is like 120 behavioral therapy. Is like
Yes.
you can share the list in the group. Like I
Yeah,
came to
I'll
read
do.
the article. Yeah.
I'll do share the book, title of the book, instead of sharing the techniques.
Huh, yeah, yes, absolutely.
I'll do
I
that.
will read the books too.
Sure.
Thank you so much. And really amazing. We have to be mindful and grateful. And as Dinakar sir says, we have to start the day with a positive attitude and positive mindfulness. Thank you, sir.
Thank you. Thank you. But actually, I have
Thank
prepared a presentation for today's presentation. Actually, I'm in between transit. So I laughed up. I couldn't do the presentation, but I made it verbally. I hope orally you got an idea from my presentation. Thank you all. Yes, Miss Nat.
Thank you so much for the session. As you mentioned in the beginning, we are always in a fix as to what technique we should use because we have a plethora of choices, right? And you ended it with a wonderful positive note, uh, highlighting that we have to, encourage the positive emotions ultimately in our clients. My question is the score that you mentioned, the plus 10, minus 10 score. How do we get that scoring?
Lovely. It is I think it is an psychometric tool we have to use. Very simple.
All right. Okay.
And what I can say that when we say the person is a normal, generally they have an over expectation. For example, level of aspiration. I know that how height I can able to jump. But when you really ask me, I can say that if it is on 6 feet, I will say that's 8 feet. It is my
Right.
expectation. I will
Yes.
say these things. But when we do psychometric assessment, we will really come to know that where I am. And there are a lot of questions are there for holistic well-being questions are number of questions are there. And even I'm working on the knowing about the present level of the person. And once if it is completed, I do share with you.
Thank you so much.
Welcome.
Yeah, thank you, ma'am, for giving me a chance. Sometimes I feel I can be positive at all the times. Sometimes, but we can't make others to be positive. While we are talking, also we don't know how to channelize them from the negative to positive. So today I got so many tips from the sir. We need to take care of. We need to consider their thoughts because of the emotion or cognitive or behavior like that. Then we can channelize them from the negative to positive. So it's a very great tip for me, sir. Thanks a lot. It is very useful for beginners like me. So thanks a lot from my heart, sir.
Thank you, Sala. There is a selfishness also there for going from clinical to positive component. The reason is, or there are many people are there, psychiatrists, clinical psychologists, psychotherapists, there are many people are there to deal with. When you take in a given time, take right now, how many people may have the problem? Severe problem, 3%. Am I right? Moderate problem, 16%. And mild problem, we can find out 20%. We take, in total, it will come nearly 36. What about remaining percentage? 36 people are having problem. The remaining people are also looking for help now, am I right? 64% of people need support of us. No one is focusing on that major population. We are focusing on that minor population. Those are having severe problems. And we are not looking at mild and normal and good people. How we can able to make them excellent. And these focus are very less. And I found that logically, okay, this is the area. No one is running along with me. No one is competing with me. That's why we come here as a positive mental health practitioners.
Exactly. So some people don't know they are in stress itself. So we need to give help for them also. So thanks a lot, sir.
Welcome.
So, Mr. Suresh, thank you so much for this insightful, interesting, and a very interactive session. You made it so simple for us to understand. Okay, in this one session, you covered most of the things that we learned in psychology over 7 years period. Okay, all therapy techniques. In that is the scale of a teacher and a good trainer, a highly effective trainer that you are. So thank you so much. I want to say some few things. Like you mentioned about wellness and illness. That's the difference that I think most of us do not get or do not have. And in the past, we've had people pushing psychiatric patients to a psychotherapist or psychologist, and it's not easy because you're dealing with someone's life and a human soul. So we have to understand that we cannot take everybody, but we got to focus on that bigger chunk or this mild patients who actually can benefit from our techniques and therapies. And you mentioned that the wellness techniques towards the end, and you mentioned to us your goal as such to reach out to those 70%. I think that's a very very humble approach, and it's I would say it's a good approach. More, I would say, like a very humane approach towards helping people, because most of them we think we have clinical patients and those patients who need severe help. But what about the rest? We've got to focus on them also. And the last thing I want to say is, like, how to make therapy a more human-centric approach. Adults need different, children, elderly, adolescents need different therapies, and sometimes we do all mix up, mix bhaji. So today, thank you so much for this wonderful session, and I'm looking forward to more sessions with you. It was very interactive and really good for the learning for all of us. So thank you so much. I'd like to thank Mr. Nanda also for organizing this session, and I want to thank all the participants here who were there, and very interactive, and also sharing your thoughts, your gratitude. So thank you so much for taking the time out today. Have a nice evening, all of you.
Thank you, Melly. Thank you so much. Can I take a leave? Thank you all for lovely active participation. So we'll meet again another wonderful title coming. Thank you. Thank you.
Thank you very much, sir.